Hello, everyone, and welcome. Again, my name is Greg Townsend. I grew up in Durham, North Carolina, about a mile from Duke Medical Center. In 1968, as a little child, little boy, 8 years old, I had 50 cents in my pocket. And as an 8-year-old, I wanted a box of Cracker Jacks. A box of Cracker Jacks. All I wanted was a box of Cracker Jacks. Some of y'all may not even know what a box of Cracker Jacks is. In a box of Cracker Jacks, there was a toy. You open it up, and there was always a prize in there. You know, I always go for the prize first, rip it open and go for the prize, you know, and see what I got, see what the prize was. All I wanted was a box of Cracker Jacks. There was a corner store in my community, and the corner store sat on the dividing line. And when I say the dividing line, it was set on the dividing line, the white community and the black community. So there was a white side of the store, and there was a black side to the store. On the black side, they didn't have Cracker Jacks. I had 50 cents in my pocket, and all I wanted was a box of Cracker Jacks. And there wasn't any Cracker Jacks on the black side. So I went on the white side to get me a box of Cracker Jacks. 1968, Durham, North Carolina. I walked on the white side, and I got my box of Cracker Jacks. I got my prize, I got my toy, and I ate my box of Cracker Jacks. And I say that to say this. There are people in many communities, anywhere USA, young people, old people, black people, under-resourced people, that are still looking for their box of Cracker Jacks. Today, that are looking for their box of Cracker Jacks. When I say that, they don't have access to jobs in their community. They don't have access to schools where they can get a quality education. When I say that, we have young people graduating from high school that can't read and write. They don't have access to health care services in their community. They don't have access, when I say health care services, not only clinical care services, but not only mental health care services in their community. They can't send their kids to the park to play because the swings are tore up. Not only that, the parks are unsafe. They can't let the children play outside. Why? Because there are, sometimes there are gangs, sometimes there are guns, sometimes they're violent. In some communities, children can't even sleep in their beds. Y'all heard the story about a couple of weeks ago, a young girl sleeping in her bed, and there was gunfire outside, bullet went inside, grazed a young child on the side of her face. So there are communities in Birmingham, other places, USA, that are unsafe to live in. So the environments are unsafe for families to raise their children, unsafe environments. Not only houses are unsafe, not only environments are unsafe, neighborhoods are unsafe, sometimes the water that people drink is unsafe, the air that people breathe is unsafe, the soil that they send their children out in the yard to play in is unsafe too. So people need a quality education, people need access to jobs, people need safe environments, people need access to health care services. How many of y'all catch the bus in Birmingham? How many of y'all enjoy the bus rides in Birmingham? Sometimes these buses break down. People need access to reliable transportation systems. How many of y'all lived up north where you can catch a bus anywhere and get anywhere you want to go to, any time of day, any time of night, or some means of transportation? We need a reliable transportation system in order to reduce some of the disparities in our community. I'm going to try to talk about some of this today when we talk about health equity. Thank you for inviting me, and I'm going to move forward with my presentation. I'm going to give you time to answer some questions also. So now we live in an era now that many of you, many young people in our community are going to die earlier than the adults. Why? Because of violence, because of crime. We have an opioid epidemic in our community. Suicide in our community is rising. The rates of suicide is rising in our community. There are many issues and problems that we need to address in public health. We need to work on these social economic conditions to create better health status for people living in our community. That's what public health to me is all about. So I spoke at the University of Georgia a couple of months ago, and this was a quote that I have. Before I went over there, they told me, they said, don't say anything on campus about Roll Tide. They said, you can't say anything about the University of Alabama. Don't wear anything red, and definitely don't say Roll Tide. So I found this quote from Sam Hunt. Folks in Alabama seem like folks in Georgia to me. I feel like you can just about combine the two, and I firmly agree with that. We're no different than anywhere south. We can combine any of these states in the South because some of the same disparities that exist in Georgia exist in Louisiana, Mississippi, Alabama. Some of the same disparities exist across the South. We can combine any of them. So y'all know my perspectives have already been stated. So what I'm going to try to do today, I'm not going to go over this. These are some of the things that I'm going to try to address in my presentation today. So, but first, before I do that, I want to talk a little bit about public health in Jefferson County. If y'all don't know, public health in Alabama was started in about 1875. 1875. You can go back and look at it. Even when I look at the literature, I saw that David Crockett came through Alabama and he got sick, almost died in Jefferson County, maybe from typhoid or either cholera, but he got sick as he came through this community. So public health started in about 1875. These were some of the timeline of some of the diseases, some of the incidents of health that occurred in our community from 1873 through 1958. And you can go back and look at all those and research all those and see the problems that we've had in this community. Birmingham, Alabama was once called not only a magic city, but it was once called the pest hole of the South. The pest hole of the South. In 1916, there were so many issues with disease in Jefferson County that the National Public Health Service sent investigators here to figure out what they could do to mitigate some of the problems in Jefferson County. Epidemics were widespread in this community, and they wanted to see what they can do. With public health, even though there were two public health departments. There was a county health department, there was a city of Birmingham public health department in this community. So they sent investigators down here and they published a report in 1916 and came up with strategies to develop a unified public health department, which is what exists now, the Jefferson County Department of Health. And these were some of the recommendations that came out of that 1916 report that was published by Dr. Carol Fox in 1916, which established the local public health department, which we see today. This was the first public health building in Jefferson County. The first public health officer was only part-time. He had his full-time practice, but he also had, he worked for the health department, county health department, on a part-time basis, and that was the first building which burned down in 1907. Dr. Jefferson Dowling was the first health officer of Jefferson County, first full-time health officer in Jefferson County. He was hired, I think, in December of 1917, and he was a health officer from 1917 to 1941. And really made a lot of great public health accomplishments during his tenure as public health officer during his time. One unique thing about he made many great accomplishments. One unique thing about Dr. Dowling was that in 1922 he was lured from his home. He was beaten and flogged by a group of angry dairy farmers because he was promoting pasteurization, and they didn't want milk to be pasteurized in this community. They had already ran two previous health officers off in this community, out of the community, and he really wanted milk to be pasteurized, and so they beat him and gave him 24 hours to get out of town. So that was Dr. Jefferson Dowling. So when I came to Jefferson County and started working at the health department in 1994, I've always asked, where were the black people? What was being done for African Americans in Jefferson County? And I still ask that today, and I asked that in New Orleans after Hurricane Katrina. what was being done for black folk in Katrina, and my research showed that there were 3 or 4 different health departments, 3 or 4 health facilities in Birmingham. There was 2 on the south side. There was 1 on the south side. There was 1 in Titusville and 1 on the south side, and then there was a Sloss Clinic, which was near Finley Boulevard, and that building is still there near Finley Boulevard, and this was a Sloss Clinic that you're looking at right now. And that clinic was, staffed by African American doctors, which were trained by the local Jefferson County Department of Health, and the nurses were trained by the health department. And that was a state-of-the-art facility. Not only were doctors, did it have doctors, it was an exercise facility, and really promoted health, general health for the people in that community. And that health department was created because of the number of babies that were dying in that North Birmingham area. And again, that facility still exists. The shell of that facility still exists. It's in North Birmingham, right off Finley Boulevard. But again, it was built for African Americans. Someone asked me, why did y'all have facilities just for black folk? And I had to remind them that there was this gentleman, and I know y'all know his name, Jim Crow. How many of y'all know Jim Crow? Y'all know Jim Crow? Jim Crow said that black folk and white folk couldn't, y'all couldn't mingle together. Y'all couldn't be in the same place together. And during that era, you couldn't have a clinic or a facility where blacks and whites could be in the same place at the same time. So in October, someone introduced me, said that I need to meet this public health worker, this former retired public health worker, Mr. Walter B. Floyd. Mr. Walter B. Floyd is 96 years old, and he lives in Smithfield today. So in October, I found Mr. Floyd, and he lives 2 doors down from where Angela Davis lived. Y'all, anybody know Angela Davis from the 60s? He lives 2 doors down from Angela Davis. And I called his son up and I asked, I said, can I come and see Mr. Floyd? I didn't know what to expect, a 96-year-old man. When I got there, yeah, he was sitting down, partially blind. But when I started talking to him about public health, he sat straight up in his chair. And he started talking about public health and his public health experience like he was a 40-year-old man. And he talked about his love for people and his love for public health just like it was yesterday. And he said to me, one of the greatest things in life was choosing a career in public health and finding my place in the public health field. He said, I predicted 40 years ago that there would be more jobs in the health field than anywhere else. He said that in public health, we always operated by the common word, to know, to be right, and to work together. Isn't that amazing? Isn't that awesome? That in public health, if we always know what we're doing, if we work together, and if we were right all the time, think about the major accomplishments that we would make in public health, not only locally, but nationally. Mr. Walter B. Floyd, he'll soon turn 97 years old, still living, still in North Birmingham. So this is the World Health Organization for Inequities. Y'all probably seen some of this before. If you haven't, you can take a picture of it with your phone. So defining health equity, we define health equity as attaining the highest level of health for all. I was a part of a national movement for advancing health equity called Place Matters. There were 16 communities that were targeted around the country. There was an organization called Place Matters out of Washington, D.C., which was started by the Joint Center for Political and Economic Studies. And our goal was to really define a strategy for reducing inequities throughout these communities which we were targeting around the country, and coming up with strategies, genuine strategies for reducing disparities around the country. And so when we look at our strategy, why place matters? Why does place matter? Our vision was to build a cohesive community where all residents are safe, healthy, and supported in reaching their full potential. Our Place Matters vision was, the heart of Place Matters is a commitment to empowering and civic engagement to improve the social determinants of health by informing and illuminating public policy debates via evidence-based research, analysis, and information sharing, building the capacity of community leaders, facilitating collective impact through planning, implementation, and evaluation. So one of the things that we knew we had to do when we talk about place matters and community matters, we knew we had to build coalitions. We know in community work that we cannot do this work alone. It's going to take all of us working together. At one time in public health, we thought that we could come in and do everything through public health, through all our expertise, but now we know it takes all of us rowing the boat together. It takes all of us working together to truly make a difference. We cannot do this work alone. We need the public and the private sector and our public health expertise, academia, working together to truly make a difference in our community. In building coalitions, we need to make sure that our messages are genuine, that our messages shape the conversation, that the narratives that we create really address the audience that we're trying to disseminate the messages to, and that these messages promote health in all policies. The other thing is we want to make sure that we engage media. You know, media can develop their own narrative. If we allow media to develop their narrative, they can develop narratives that's really not true. So we wanted to make sure that we engage media in the proper way to make sure that they understood that the narrative that they promote is the true narrative that really address the issues that we face in community. So this is an example in terms of how we should engage media in our community. The other thing that we want to talk about, is everybody familiar with health in all policies? Is everybody familiar with health in all policies? So what health in all policies is, we want to make sure that our policies not only address the benefits, that it benefits people in our community, that the policies that we create in our community doesn't create barriers. Because sometimes we can create policies that benefit some, but it may create barriers for others. And I'll have some examples of that as we move forward in our presentation to show you how a policy can be a benefit to some, but create a barrier for others. So one policy that was a benefit and a barrier was housing policy. Back in the 50s and the 60s, they created housing policies for the suburbs. You know, whites could move out of their communities and move into the suburbs, and there were subsidies provided for people to move into the suburbs, but that policy wasn't equitable for everybody. People who were low income or people who were African American couldn't get those subsidies because they were redlined. You couldn't move out into those communities. So therefore, some people were benefited by those particular policies, and they were policies created as a barrier for others. But when laws changed and those minorities could move into those communities, those housing values were so high that they couldn't move. They couldn't move into those communities. So the law was created as a benefit to some and a barrier to others long term. And it locked some people into poverty because when they created projects, and y'all know what housing projects are, those housing projects were created to benefit some, but look what housing projects have done for people today. It's really locked a lot of generations of people into what? Poverty. Generations of poverty that they have created. Wage inequality has become, the laws that relate to wage inequality have become a benefit to some and a burden to others. You look at women and we talk about wage inequality. A man and a woman can have the same degree, but who makes less? A woman can make less than that man. So that's the way that a policy can benefit some and be a burden to others. So the guiding question is, what steps can we take to improve equity in our community? So y'all seen this slide before? Everybody seen this slide before? So when we talk about equality, the first slide, you know, everybody has the same size box. Am I correct? Everybody has the same size box. You got a tall guy, you got one that's middle height, and you got the little fellow there on a box. Everybody has the same size box, but the smaller guy cannot see the game. You know, he may be peeping through the crack, but he can't see the full game. But everybody has the same box. But is that fair? It's not fair. When we look at equality, we've given the smaller person 2 boxes, taking a box away from the taller person. Some people question, is that fair to take the box away from the taller person? and give it to the smaller person, there is some questions of that. But at least we created equity because we gave the smaller person what they needed rather than just giving everybody the same thing. So there are some other depictions of the same slides. Some people say that we should remove the fence, we should remove the barriers from the beginning and not worry about creating equity or equality. Just make it liberation so that everybody can be free to gain the same access as everybody else, and just making sure, like the third slide, giving people exactly what they need. Is everyone familiar with Monopoly? How many of y'all like the game of Monopoly? Is the game of Monopoly fair? It is not fair. Why is it not fair?
Well, the way most people play or the way I play?
Oh, so if we play the game of Monopoly and we play this side of the room and this side of the room, if you guys started the game 30 minutes ago and y'all started playing, you guys would accumulate what? Wealth. Am I correct? So if I started this side 30 minutes later, you guys would have accumulated wealth. Am I correct? Y'all would have hotels and houses and railroads and property. Am I correct? So 30 minutes later, I start these guys. What would happen to this side of the room?
They would be at a disadvantage.
Why would they be at a disadvantage?
Because we've already accumulated wealth.
Y'all would have already accumulated wealth, and you have leverage, and they started late. And what would that do to them? Every time they land on your property, what would happen to them? They would have to pay you, and they would lose. They start off with $200, right? That's equity. They start off with $200, and they lose that $200 the first time they land on your railroad. Am I correct? So where do they start? They're back at zero. And they have to wait to go around to go, but they never make it to go. They may end up in jail. Am I correct? Isn't that how society is for those who have started because of slavery, right? Because of slavery, they start behind. Game of Monopoly. Let's equate slavery to a game of Monopoly. They start behind. So now we're asking them to catch up. Pick yourself up by your own bootstrap. You've already started behind. Now we want you to catch up. But every time I land on your property, I got to pay you. So now I'm back in the hole that I started in from the beginning. So is it fair? So how do we create fair for everyone in our society? You guys have seen this before, and we understand that we used to think of a medical model that our genetic would determine our genetic makeup would determine our health outcomes, but now we know that our individual behaviors and our social and economic factors have a determining factor on our health more so than our health outcomes or access to healthcare services. And we also understand that the social determinants of health, the circumstances where we are born, where we grow up, where we live, work, and play are a determining factor on our health outcomes. And these are the social determinants of health. And I started out by talking about those health determinants when I was talking about jobs and education and access to healthcare services and environment and transportation. Those are some of those factors which contribute to our poor health outcomes. And so that's why we need data. We need good data and evidence to help us understand how these determinants of health contribute to our poor health outcomes. So I'm going to talk a little bit about that, and I'm going to talk about this report that we published in 2013 that really has helped us shape our initiatives for Jefferson County, and how this report has really helped us improve the quality of life for many in our community. Has the work been completed? No, we still have a lot of work to do. So in 2013, we published a report, and the report was The Health of Jefferson County, 50 years since the Civil Rights Movement. And you can get this report online at the National Collaboratives for Health Equity. You can go to their website, National Collaboratives for Health Equity, and you'll see that on the slides. I think we're going to give you the slides. You'll see the link on the slides, but it's at National Collaboratives for Health Equity. So what we found from the data in the report, and there's evidence to show that laws and policies that were put in place, the 1926 Comprehensive Plan for Birmingham and zoning laws that were put in place, really has shaped some of the inequities that exist in Birmingham today. Highway construction, we look at the highways that were built in Birmingham. Red Mountain Expressway was cut so that people, rich people, white people, could get out of the city of Birmingham and go over the mountain and get out of the city. You know, Interstate 5920 was cut around the city, cut through African American communities, and so it could bisect some of the more wealthier communities in the city. UAB was built on African American communities. I don't know if you guys knew that. The property that was taken from the people that lived in this community here, they told them that they would pay them for it. A lot of those families never received any reimbursement for the property that was taken, and that's documented. It didn't come from me, it come from the literature during that particular time. A lot of that was urban renewal. A lot of that were things that were, at that time, Hilburton money to build parts of UAB property, Cooper Green Hospital, and other things that were going on. But a lot of things that happened in our community was because of a legacy of segregation. We talked about that guy, Jim Crow. Everybody know who Jim Crow is. And a lot of things that were going on that led to poor health outcomes in this community. So we understand that your zip code may be more important than your genetic code in predicting health outcomes and life expectancy. And I want to explain that through these maps, a series of maps that I want to show you moving forward. So this map is a map of Jefferson County. The blue dots indicate where African Americans live in Jefferson County. So when we look at the blue dots on the map, we see the black lines. The black lines are the interstates in Jefferson County. So you have Interstate 20, which runs from Atlanta, and it intersects with Interstate 59, which comes from Gadsden. Everybody know the interstates? The other interstate is Interstate 65, which runs north-south, right? And then you have Interstate 459, which runs the south corridor of Jefferson County. Again, the blue dots represent African Americans, the red dots represent the white population. There are some green and yellow dots which represent the Asian as well as the Hispanic population, which are south of Interstate 5920. There are some Hispanic populations near the airport and some other areas close to the downtown area, and you probably know where they are if you ride around the community. They are. So everybody know where those communities are along Interstate 5920? So when we look at poverty, some of those communities have 40% poverty rates in this community. The darker the color is, darker the green is, the higher the rates of poverty in those communities. So you see the interstates, the same interstates that I pointed out earlier. The darker the color, the higher the rates of poverty. Does anybody see anything, any patterns yet? Anybody see anything? What you see? Somebody.
More poverty in the communities along the highways, which are the black communities.
Okay, more poverty along the communities of the highway where the high rates of African Americans live. Okay. Next, we talk about food deserts, which the map has changed a little bit because they built water Publix downtown. So that eliminated a food desert, which is in the downtown area. That was a food desert, but now it's not a food desert anymore because there's a Publix down there. But how many people live? Who lives downtown? It's not the African Americans anymore. There are some, but the majority of them aren't African Americans. But downtown is not a food desert. In the Kingston community, and there are some of us who work in the Kingston community, they've done some things in the Kingston community where they created some markets and have really pushed back on some of the food deserts there. And we've done some other things to push back on some of those. But still, where majority of where the food deserts is are in those same communities that you pointed out also. So we look at the lower life expectancies, the darker the color, the lower the life expectancy, the lighter the color, the higher the life expectancy. And there may be a 10-year difference from zip code to zip code. The further south you go, south of Interstate 5920, the higher the life expectancy. You know those communities, Mountain Brook, Hoover, Vestavia, Homewood, Shelby County. Those communities are wealthier, right? So the higher the life expectancy because they have access, more access to things that would really cause their life expectancy to be higher. Where there's high concentrations of poverty, the lower the life expectancy in those communities. And you can see the hotspots for life expectancy, where they exist also. So this is just some key stats from 2015. 26.3% of children are living in poverty in Jefferson County. 2 African Americans are unemployed for every 1 white person employed in Jefferson County. 60,000 single parent households, which make up 22% of all households in Jefferson County. Infant mortality rate in Jefferson County is 1.8 times the national rate. Infant mortality rate for African Americans in Jefferson County is 2.9 times higher compared to whites in Jefferson County. African Americans are 3 times more likely to live below the poverty level. Hypertension rates as a percent of the population of African Americans 18 or older in Jefferson County is 1.3 times higher compared to whites. Hypertension mortality rates for African Americans is 2 times higher. Heart disease mortality rates for African Americans is 1.2 times higher compared to whites. Diabetes mortality rates for African Americans is 2 times higher. Percent of obesity for African Americans is 46.9% times higher. So if we're going to improve the health of people in our community, in those under-resourced communities, we're going to have to really do something about the social determinants of health in our community, in those communities. And to do that, we're really going to have to work on our allocating resources properly, pooling our resources together, and really making decisions and make sure that our decisions that we make don't increase the burden on some and benefit others in our community. So one thing that we have been doing is we have been conducting a series of assessments, and you can go to the health department's website, and the link is on the bottom of the page, and look at the series of assessments that we have, and look at the data that we have at the health department. It's free. It's out there for you to look at if you need the data. Sometimes you ask, where can I find this information at? You can pull our reports that we have at the health department. And from the data that we have, the quantitative and the qualitative data, we came up with strategic initiatives. And what they are is we want to work on reducing health disparities, promoting physical well-being, optimizing the built environment, optimizing healthcare access, and promoting and improving mental health. We also have been working on collective impact, and what that means is that we're going to work together, public and the private sector, working on multiple levels really to address the social determinants of health in our community. I said that it's not just the health department's responsibility, it's all of our responsibilities to reduce the effects of these social determinants, these factors in our community. So we all have to work together to do that. We all have to communicate together. We all have to be on the same page. So we have been working collectively to make change happen in our community. So our vision is that Jefferson County is a healthy, thriving, and connected community, and is recognized not only statewide but nationally through long-term efforts to improve health outcomes and community health by leveraging funds to directly support member organizations, provide grants, and support in health improvement projects. And these are some of our local partners that we're working with, and many of these organizations are already doing the work in our community to improve health. Community Foundation, our local health department, United Way, our local Y, and our Jefferson County Collaboratives for Health Equity. So some of our accomplishments that we showed measurable progress. We promoting smoke-free environments in our community. How many of y'all enjoy going to restaurants and you don't smell like smoke when you come out? Yes, I do too. You know, and I hope that we can work on some of these convenience stores, because I hate to go buy gas and you walk in the gas station, you come out and you smell your clothes, and you know, and that's the next thing that I really want to work on. And then improving access to physical activity. Are y'all enjoying many of the trail systems that have been created around the community? I have, and the bike trails and the bike share and those opportunities where we can get out and really enjoy ourselves on the outside. Great opportunities, and a lot of that work has been done through our collaboratives. Other ways, again, we've been measuring progress is promoting opportunities for our children to get out and play, and to make sure our daycares are safe, our tattoo parlors, for you young people who like tattoos. I know some of y'all like that stuff, but and make sure that when you go to those places, that they are safe, and to make sure we have laws in place that are benefits, and don't create barriers for that. So we want to make an impact so that we can change people's lives, not only those who are able, but those people who are disabled also. You look at Railroad Park. When you go to Railroad Park, is Railroad Park a park that is, does it create barriers for those who are disabled? If you walk around that park, they got planks everywhere, and they create barriers for people who are in a wheelchair. I don't know if you have friends that may have a disability, because it has steep inclines and it has planks and all those kind of things. And we talk to them about that, because when you build a park, you want to make sure that everybody can utilize the parks that you build. So, we need to talk about that health in all policies and make sure we do things that everybody can enjoy. So again, those are some of the things that we're working on, and some of this has already been accomplished. The city of Birmingham is making sure that we have sidewalks that go somewhere. A lot of places in the city of Birmingham have sidewalks that start and end, or sidewalks that go up and come down. I don't know if y'all seen some of those sidewalks that buckle in so many communities. So we've been working with the city of Birmingham to make sure those sidewalks are adequate. So how do we make equity a reality? And make sure that health equity is understood. Health equity is a shared vision in our community. Health equity is a factor in decision making. Health equity is included in implementation, and health equity is in all policy. And these are the guiding principles that we develop for health equity. Oftentimes we go in and we tell the community what they need because we are the experts, and that's the wrong way to do that. We want to make sure that we involve the community that's negatively impacted by health disparities, include them in the development process. We want to ensure that our objectives prioritize people in communities negatively impacted by health disparities. We want to ensure that health equity messages are appropriate and widely disseminated. We want to value both community and technical expertise. Sometimes the people who know best about their community are the people in the community. They know their community better than we do, and we need to utilize their expertise. We need to support and build the community's capacity to act. We don't need to do everything for the community. We need to help them do the things that they need to do to make their communities better. We don't need to give them power. They already have power. But we need to give them the capacity to act. And we need to leverage opportunities to advance health equity. And we need to work not only locally, we need to work with our national partners to make this happen. So when we talk about equity, we need to look at things through an equity lens and make sure that health equity equals fair opportunities where everybody can live a long and healthy life. So I talk about Jefferson County Department of Health. 1917, there are many things that we accomplished. This last year was our 100th year in public health. So we still are celebrating 100 years of public health practice. And so look out for our public health address this year. And we should be coming out with our annual report, which will highlight many of our great accomplishments in public health over the last 100 years. You'll be amazed at some of the things that we have been recognized, not only locally, but we've done nationally to improve the health of people in Jefferson County. So in 1950, one of our health officers, Dr. George Dennison, wrote a letter to the health officer at 2050. And he was very insightful. And this is what he wrote to the health officer in 2050. We found this letter in our archives, and it reads, he said, it's my hope that by the time this is read, new advances in medicine and public health will have eliminated and controlled many of the problems currently confronting public health administrators. Included among these problems are the need for adequate medical and hospital facilities for all segments of the population, better housing for low-income groups, the solution to the problems of poor nutrition, the control of air pollution, the care and treatment of chronic diseases in middle and later life, the development of resources and facilities for the control of problems in the field of mental health. And this letter was submitted June the 29th, 1950 by Dr. G.A. Dennison, MD, Health Officer. So thank you.